everyone, welcome to today's video which is all about Parkinson's disease. So what is Parkinsonism? So Parkinsonism is a chronic progressive motor disorder. What do you mean by motor disorder? It is the movement disorder. That is, the movement of the person who is affected by Parkinsonism is impaired. So that is motor disorder. They are extrapyramidal neurodegenerative disorder. Extrapyramidal, which means a group of movement disorder which affects the brain outside the pyramidal tract, okay, which is responsible for the voluntary motor movements. And neurodegenerative disorder. There are certain neurons present in the brain which undergo degeneration and they die. So whenever there is a loss of neuron, there is a less production of a neurotransmitter or a chemical messenger, that is dopamine, in the basal ganglia. So whenever there is a lower production of dopamine, why? Because of the degeneration of the neurons which has taken place. So there is a decreased production of dopamine in the basal ganglia, which can increase the symptoms or which can produce the symptoms of Parkinsonism disease. Okay, what is idiopathic Parkinsonism? So whenever the cause of this Parkinsonism is unknown, that time it is called as idiopathic Parkinsonism. And Parkinson's disease is a type of idiopathic Parkinsonism. Now, what are the characteristic features a patient faces when he is suffering from Parkinsonism? So the first one is the rigidity, that is the muscle becomes stiff. Okay, there will be stiffness, there will be rigidness in the muscle. Okay, then the second one is the tremor, which is the resting tremor. In case of Parkinsonism, we can see the resting tremor, which means whenever the muscle is in the rest position, still we can feel the shaking or the jerking sensation of the muscles, especially in the hands and fingers. Okay, that is your resting tremor. And the third one is the echinacea or the bradykinesia. So echinacea means the absence of movement, and bradykinesia, which means the slow movement. That is, even when we are walking or when we are standing or even when we are writing something, there is a slow movement or the muscle movements is slower. That is your bradykinesia. These are the main characteristic features of Parkinson's disease. Other than this, there are some other symptoms like postural reflexes impaired. That is, in this photo, you can see this man, the postural reflexes is impaired. That is, he is not standing in the upright position. There is no balance in his position. That is your postural reflexes being impaired. The second one is the mask-like faces. So these are the expressionless faces. Whenever there is the impairment or whenever the facial muscles are impaired, that time we can see a expressionless fixed appearance. That is your mask-like faces. The third one is the excessive salivation. As I have said, that whenever there is the impairment in the facial muscle, that time the muscles which regulate the saliva management, that is impaired, which causes the excessive salivation. And the last one is the unstable gait. So in case of Parkinsonism, people can face festinate gait. Okay, what is festinate gait? Abnormal walking pattern. Okay, which means a patient when he is unable to stop himself from moving forward, that is your anteropulsive gait. And whenever he is unable to stop himself from falling backward, it is your retropulsive gait. So what kind of gait is seen in Parkinsonism? That is your festinate gait, which can be anteropulsive or which can be retropulsive. Now, what happens in the Parkinsonism disease? Why Parkinson disease is caused? So, always remember, in basal ganglia, there are two types of neurotransmitter present. That is, in basal ganglia, the output neuron is controlled by two neurotransmitter. One is your dopaminergic neuron, and the other one is your acetylcholine neuron or the neurotransmitter. So these two neurotransmitters, there is a balance between them. Even though they have a opposite action, their mode of action is different. That is, dopaminergic have a inhibitory action, whereas acetylcholine shows the excitatory action. So they both have a opposite actions. So there should be a balance between them to maintain the normal function of the basal ganglia. That is, in this place you can see there is a balance between both this chemical messenger, that is a neurotransmitter. So it is a balance. So there is no Parkinson disease seen in this condition. It is a normal. So the balance is seen between these neurotransmitter. Whereas in Parkinsonism, there is an imbalance of the neurotransmitter. That is, there is an increase in the level of acetylcholine or there is a decrease in the level of dopamine. Due to this imbalance, we can face different types of symptoms of the Parkinsonism disease. Why? Lesser dopamine level or the increase in the acetylcholine level. So what is the pathophysiology of this Parkinson disease? So how Parkinson disease or how the dopamine level is reduced and it contributes to the Parkinson disease? So a patient might have the degeneration of the substantia nigra. For the development of Parkinsonism disease, the first thing which is happening is a degeneration of the substantia nigra, which means there is a destruction of dopaminergic neuron. So there is a destruction of the dopaminergic neurons in the substantia nigra. So how does this destruction takes place? Due to the deposition of the inclusion bodies, which is the Lewy bodies. Lewy bodies are the abnormal protein deposition in the brain. Okay, so these Lewy bodies are deposited in the nigrostriatal pathway, which causes the degeneration of the nigrostriatal pathway or the destruction of the dopaminergic neurons. So there is a degeneration of the dopaminergic neurons, which cannot produce excess amount of dopamine. Since there is a destruction of the dopaminergic pathway, so these neurons will not produce dopamine, which is required for the balance. So because of this degeneration, there is a decrease in the dopamine level in the brain. Okay, since the decrease in dopamine level, that time what will happen? There will be the increased level of the acetylcholine. So there is an imbalance created between both this neurotransmitter. These contribute to the symptoms of Parkinsonism and thus it leads to the Parkinson disease.